talk. Bye, Ron. He's got to go get to the airport, right?
No. I can be with you. I want to hear these speakers tonight. I can be with you at least 15 minutes for the rest.
Okay, all right. Okay. Well, welcome everybody. Thank you for joining us tonight for our February Tuesday talk. I checked with Bob, and he heard that we had over 100 registrants, so people are still signing in. So we'll look forward to their joining us. So in terms of format, tonight we will have, I'll turn it over to Richard Mewhinney, who's going to do an introduction of our speakers. They will do their presentation. District Governor Ron Dick will thank our speakers. And then I'm going to turn to Joanna DeBoer, who's going to talk about our March Tuesday Talk focus. So I will ask you to ensure that you mute yourself. And if you have questions, please put them in the chat. District Governor-elect Joseph Siosa and District Governor nominee John Burns will be monitoring the chat. And at the end of the presentation, they will raise those questions for our presenters. So with further ado, I'm going to now turn the microphone over to Richard Mewhinney.
Thank you very much, Past District Governor Beth. And I'm suffering from a minor malady this evening. I was supposed to have eye surgery today and instead had to go to my ophthalmologist, and I'm looking through blurry eyes. So in that context, let me just welcome everybody. This is our second session for Water, Sanitation and Hygiene District 7070 Water Summit for the year. We have two fantastic speakers tonight, John Oldfield and Ryan Rowe. John Oldfield is currently the Policy and Advocacy Advisor for the Global Advocacy Fund of Swiss Water and Sanitation Consortium. His biography was published as part of the program. It would take me probably 20 minutes to read his biography. So I'm going to dispense with a substantial portion of the biography. Just would like to acknowledge the fact that it is wonderful to have him included. I will also mention that our second speaker tonight will be Ryan Rowe, and he is the Executive Director at HANWASH. Ryan which is the Haiti National Water, Sanitation and Hygiene Initiative. And both speakers are internationally known and acclaimed. They have a great resume, each one. Ryan is joining us from Brazil this evening. And John, I'm sorry, I'm not quite sure where you're calling in from. I'd like to start with John Oldfield. Thank you very much for your attendance this evening. Really looking forward to hearing what you have to say.
Hey, Richard, thank you. Thank you so much. Yeah, I'm calling in from Alexandria, Virginia, right outside of Washington, D.C. And thank you, Richard, and to all of you for joining this evening. And thank you, Ron Denham. I'm glad you could stick around here. Thank you for sort of catalyzing this opportunity. Keynote address or not, I'm going to be brief, and Richard, hopefully fantastic, because you promised that. So I've got a lot of pressure on me right now. I'm going to be brief because I really do want to hear your question. I really do want to get a dialogue going if possible. And I certainly want to hear from Ryan Rowe. I've been following for a number of years with great interest his work with HANWASH in Haiti, and very much look forward to an update there. So, the title of this session is WASH, Water, Sanitation and Hygiene, a foundation for successful, sustainable progress for many related challenges. So, Ron and I were talking a little bit about this, and in preparing for tonight, I was thinking both about WASH as an end goal, an important development objective itself, and of course about WASH as a means towards other end goals, about WASH's contributions to the other SDGs, the other sustainable development goals. So I was thinking of maybe if we had like an SDG wheel we could spin, and wherever it stops, whatever SDG it stops on, then I could make a pitch for WASH as a foundation for sustainable progress to that SDG. But I don't have a wheel, and I want to instead just go through a couple very quickly and then do slightly deeper dives into three of my favorite SDGs beyond SDG 6 for water and sanitation. So let's start with SDG 2, zero hunger. Now, calories and nutrients are frankly only good if they stay in those bodies. They're only good if you wash them down with safe water. So the way I look at it, the job of the hunger people, and I hope this visual comes through over Zoom here, the job of the hunger people is to put calories into these bodies, put nutrients into these bodies. The job of the WASH community is to keep those calories in those young bodies by preventing waterborne diarrheal disease. So you put the calories and nutrients in and you stop them from being wasted by making sure that safe drinking water is included there. So SDG 4, quality education. Don't have enough girls in your school? Well, in many cases, that's because they're spending their childhood hauling water on their heads and hauling firewood on their heads and hauling cow dung on their heads to burn at home and make that water potable. You don't have enough older girls at school? Well, it could well be because those schools don't have menstrual hygiene products easily accessible. SDG 8, decent work and economic growth. This might not be the first thing you think of when you think about WASH, but and maybe Ryan can attest to this, but there are these children in Haiti, essentially slave, called Restavek children, and they are indentured, is the nice way to say it. They are enslaved to wealthier families in Haiti, and many of these kids, super young, spend their childhoods carrying not school books, but dirty water on their heads in the absence of WASH infrastructure. So if you want to focus on SDG 8, if you want to eliminate modern slavery, safe drinking water is a pretty good place to start. SDG 11, sustainable cities and communities. We read the headline, urbanization, crowded informal settlement, infectious disease outbreak in these densely populated environments. Well, formal cities and even more so informal settlements are not livable without WASH. None will be stable. And to put it bluntly, going back to FDR times, the inhabitants of these informal settlements will not be free from fear and from want. So let me just go a little bit deeper into a couple of the other SDGs. And as I go through these, I'm thinking, I'm thinking about, I'm here in DC, I'm a wonk. I'm thinking about data, I'm thinking about evidence, I'm thinking about the problems. But more importantly, I'm thinking about solutions, club level and higher level solutions. I'm thinking about each of these scenarios as essentially a call to action to catalyze more sustainable programming and to accelerate progress, not just on SDG 6, but in the first case on SDG 3, good health and well-being. So imagine that you're a mother and you're about to give birth and you go into a healthcare facility, as you've been instructed to do in your country, Sub-Saharan Africa, Central America, South Asia. You go into that healthcare facility without WASH. Well, a couple things happen. You are required to bring your own water. Secondly, there's no proper place for you to go to the bathroom and clean yourself or anybody else. And third, the maternity wards in these healthcare facilities, they know that they cannot guarantee WASH. So the first thing they do when you walk in as a mother about to give birth, first thing that happens is that they hop you up on antibiotics, just to avoid sepsis and any number of other possible infections. So in the context of SDG 3 on health, WASH is important as its own development objective. A healthcare facility without WASH is not a healthcare facility. But you also can't have this hospital or any sort of a healthcare facility sort of propped up on these columns made up of, if you get the visual here, these facilities are propped up on antibiotics. You can't just prop that healthcare facility up on drugs. It needs that strong WASH foundation to ensure proper IPC, infection prevention and control, and to contribute to the fight against superbugs, against AMR, antimicrobial resistance. The more antibiotics we pop into these bodies, the less those bodies and other bodies are able to fight off other bugs that pop up. So within the Rotary context, if I might, two calls to action. One is, as we all know, and you know far better than I, a Toronto club can identify a healthcare facility in a given country, work with the local community, work with the local government, work with the local Rotary Club to assess and solve that problem. But let me not stop there. This is Rotary, so let's make this more difficult and more meaningful. My thinking is that a Toronto Rotary Club can double down and catalyze a wash and healthcare facility project in a cholera hotspot. Cholera is an evil waterborne diarrheal disease that can kill within hours. So why not do a wash and healthcare facilities project in a cholera hotspot, perhaps working in tandem with the World Health Organization's Global Task Force on Cholera Control. So provide WASH to that healthcare facility, but also use that healthcare facility and its centrality to the community to work with the local community about how to educate them on not just treating cholera, but preventing its transmission in the first place. So feed two birds with one stone. We've got cholera around the world. It's everywhere, but it is immediately squashed in the northern countries. And it's important to recognize that this is not because we're all vaccinated against cholera. Very, very few of us are anymore. It is important to recognize that we don't have cholera here because we have WASH infrastructure. So the last kind of fun idea I have about WASH and healthcare facilities is, why not provide every patient, inpatient or outpatient, with immediately on their discharge with a couple of bars of soap wrapped in hygiene messaging, wrapped in cholera prevention messaging. Give them a couple of bars of soap, some cholera prevention messaging with their discharge papers. Let's use WASH and healthcare facilities programs as an opportunity to work on the software, on behavior change as well. So SDG 4, quality education. Now, dare I say, anybody can go out there and build a school. You can put 4 walls, put a roof, you can hire a teacher and so on, but will you get customers? Will you get students? Will they be healthy enough to learn? Will they be able to stay in school for the longer periods of time that we all want them to be in school? So with the WASH in schools, the challenge, I like sort of the before and the after picture. The before picture is certainly that girl carrying water on her head. We've all seen these pictures, and they're beautiful, and they're photogenic, and the flowing dresses, and the cute outfits. And you know what? I absolutely despise these photographs, as artistic and as colorful as they are. That girl is probably 90 pounds. And that bucket of water she's carrying is probably 44 pounds. Do the math. You try doing that for 4 miles, right? Now, the after picture, we all want to be that after picture. The after picture, of course, is that same girl carrying school book on her way to a classroom. The after picture is that classroom filled with girls and boys healthy enough to learn and able to stay in school for more years. So, a WASH in schools program consists of water. It consists of gender disaggregated sanitation facilities. It includes hand washing stations. It includes menstrual hygiene management and products. It includes privacy. It includes dignity. And it includes a plan to maintain all of these services over the long term. For example, who's going to pay the cleaners to take care of these facilities properly? So once again, I've got for a non-Rotarian, I've got a lot of faith in Rotary. Let me make this a little more complicated. Let's talk not just about WASH in schools, but let's talk about WASH in schools in the most marginalized communities across the globe. I mean, you've got the poor, you've got the poorest of the poor, and then you've got the poorest of the poor living with physical and intellectual disabilities. So my specific call to action for your district and its clubs is to think about launching a Wash in Schools effort in a special school, a school catering specifically to students living with physical and intellectual disabilities. This is part of the SDG. This is part of 100%. These are human beings. They have every right, and we've committed to making sure they have WASH and education under the SDGs. So imagine this. Imagine we invite the head of Special Olympics to have lunch with Ramesh Agarwal, the head of Rotary's Wash in Schools efforts in India. So you've got the head of Special Olympics, you've got Ramesh, and you've got your DG, Ron Dick, and they launch an effort to get WASH to a special school in India. Now I hear some of you complaining that's not particularly ambitious. Okay, well then how about 100% of special schools in one district in one state in India? Or how about every special school in an entire state in India? You know, this is doable. It's solvable. How big of an effort can a Rotary Club in Toronto catalyze? So the third SDG that I want to briefly mention is one that's often overlooked by a lot of folks, which is SDG 16, peace, justice, and strong institutions. A few years ago, I was at an event called the World Justice Forum. You got 500 lawyers in a room talking about the rule of law. Way more fun than I'm making it sound like, but you got 500 lawyers talking about governance, talking about democracy. A question was raised. What is the primary school for rule of law? What's the primary school for democracy? And my answer to that is the primary school for the rule of law is the Village Water Committee. So once again, WASH is important per se, but it's also important as a means to more open, more transparent, more democratic societies. And I might say especially for women, because a lot of these rural women, often illiterate, get their first taste of participatory democracy in that hyper-local village water committee or sanitation committee or HIV/AIDS awareness committee. The action is this: there are myriad opportunities for a Rotary Club in a community to strengthen the efforts of the local WASH committee to meet their members' self-identified WASH needs. There are also opportunities for one Rotary Club in one capital city to urge that country's parliament to form a WASH caucus, sort of a group of members of parliament working together from within parliament to help accelerate progress toward WASH in that country, but also strengthen that particular institution, their parliament, making parliament more responsive to its own people. So I see WASH once again as an important end, but also as a means to, let's say, pave that two-way street between people and their governments. So I'm gonna get out of the way here, and I want to hear from Ryan. Let me conclude by sort of re-emphasizing my thinking about Rotary, which is that it's your strength, not the money or the business acumen or the technical skills, but rather looking at it from the outside, your convening ability, your voice, your ability not simply to do stuff, but to get stuff done with a holistic approach and hopefully at scale, as you've done with Polio Plus. So, in parting, I'd say as you're thinking about your club's activities and about district level activities, about global grants, about programs of scale, yeah, think about that specific project in that specific facility, that specific school. Think about how to work with the local community more closely. Think about how to work with local government to ensure the sustainability of the effort, to ensure long-term quality control, long-term operations and maintenance, and of course, potentially the scaling up of that piece of work into a much bigger program. So I continue to be inspired by your work across the globe. I salute you all. I applaud your efforts on Polio Plus and far beyond. And frankly, I look forward to tracking and maybe even aiding and abetting your success in the WASH sector going forward here. So thank you very much for the opportunity.
Thank you very much, John. I think that I saw a couple of questions come up in the chat room. You may want to take a look in there. One in particular I'd like to direct to Neelam Betty. I think we have just a second if you want to summarize your question. Let's get that out to John, see if we can get a quick answer before we go to Ryan.
That was more of an observation. John, you did a great job of showing how the various SDGs are linked and how WASH is linked. And a comment here, and perhaps Ryan, the Rotarians can comment on that. Even in Rotary, we have different areas of focus. And too often, each area of focus will work in isolation. So I think that we cannot work in silos. So that was more of an observation than a question, but I invite any comment for the area of focus experts.
Well, I'll weigh in on that real quickly. This is John. I think, I gave my talk about the SDGs, the Sustainable Development Goals. I could have said exactly what I just said about the Rotarian action groups. I'm following the Rotarian action groups that are focused on children's health and maternal health. I'm following the connections between Polio Plus and WASH. I'm following the interactions between WASH and the new environmental sustainability Rotary action group. So you replace SDGs with RAGs, and I could make the same speech. That doesn't make it easy. It's hard enough to get a project done in Rotary within one particular silo or anywhere. It doesn't make it easy, but it is important to at least ask these difficult questions and then to struggle to find the right answers. So we're not just building a building that's not going to have customers. We're not just poking holes in the ground, or we don't suffer from unintended consequences of well-meaning projects. So super good. Whether that was a question or a comment, it's very valuable. Thank you, Neelam.
There's a question for John. The question is, why don't you join Rotary?
Well, that's it. My simple answer is, then I'd have to play by all the rules. And it's easy. It's super easy for me to dream a little bit here, but I'm a big fan. But I think I can do more good from the outside than from the inside. Honestly, I have absolutely no objection. But it's a funny question and an imperfect answer.
All right.
Well, thank you very much. I'm sure there may be some other questions, but in order to ensure that we have the opportunity to hear from both of our speakers tonight, I would like to reintroduce Ryan Rowe, this Chief Executive Officer, Executive Director at HANWASH. Ryan, it's truly a privilege to have you here tonight. We look forward to hearing from you and what you have to say about that. Thanks very much.
Thank you, Richard. It's really, really great to be here. Thanks for having me. I'm joining you from Brazil. I'm here for the presidential conference on WASH, environment, and disease prevention and treatment. And President Shaker will be joining us in a couple of days. Ron is on his way, as you know. He'll be joining us too in a couple of days. And HANWASH will be featuring on the bill. So we're all excited about that. So first, I just want to thank you all for inviting me to speak with you this evening. I'm really excited to be able to connect back to Rotarians in Canada and be able to share the work of what HANWASH is doing. I see a few familiar faces. Mike Stafford's here, and Neelam is here, and it's been great to have you involved in HANWASH. And of course, Ron is a huge supporter of HANWASH, and we're grateful for his service to leveraging the technical expertise of WashRag and the partnership that he has brought to bear for HANWASH there. That's been great. And John, such a passionate, articulate, and respected voice and advocate for WASH around the world. He mentioned in his presentation that building democracy and good governance at the community level starts with the village water committees. And that's fundamentally what HANWASH is all about. I like to describe HANWASH not as a water and sanitation program or an initiative, but really about building better governance at the municipal level, at the local level. And it's a recipe. The HANWASH model is a recipe that could be applied for any any social, environmental, or economic challenge that a country is facing. There's no reason it just needs to be restricted to water and sanitation. And that is actually the premise of my speech to the presidential conference on Friday night, to try and inspire Brazilian Rotarians how they could use a hand wash model for the benefit of their country. So I'm not able to speak off the cuff like John like that. I have to show you some PowerPoint slides. If you excuse me, I will show you some content around hand wash, a little bit more of a structured presentation to give you a sense of what hand wash is doing and what it's all about. So if you excuse me, I'm just going to share my screen and we'll get going. So the first thing, you know, is hand wash is primarily a Rotary inspired and Rotary led initiative. It really started to gain traction during the year in which Barry Racine was president-elect, following the Atlanta Convention in 2017, and then his closing speech in 2018 at the Toronto Convention. And then from there, it started to grow wings. We can say that we are truly flying now. Hand wash is an initiative that is led by Rotary leaders and Rotarians from 10 different countries, primarily the Caribbean and especially Haiti, which is fantastic. So it is truly a locally led and a Rotarian led initiative. And we're extremely proud of what we're doing here. You know, the challenge, you know, access to wash is a global challenge. Haiti is more pronounced, much more pronounced than many other countries. Roughly half of their water and sanitation infrastructure doesn't function whatsoever. You know, accessing safe and reliable drinking water supplies is very scarce in many parts of Haiti, particularly the cities. And as a result, it commands a premium, long lines to be able to find it. And that's something that we're working to change. You know, Rotary obviously is very, very passionate about water and sanitation and has done much effort in Haiti, particularly after the earthquake, which happened in 2010. After that earthquake, a lot of Rotary projects around water and sanitation were developed and implemented in the country. Something to the tune of about $4.6 million was implemented in the country, 44 projects, as you can see throughout. One of the challenges, though, was that many of these projects were not really coordinated, not with the government. They weren't coordinated within Rotary. So every project was just a little piece that wasn't really talking to the other. And so there was a certain point at which Rotary realized that it was contributing to the lack of a coordinated water and sanitation strategy for the country of Haiti, and it needed to be rethink how it was doing things, try to find a way to be part of a solution. One of the problems with many of these projects is that they focused on charitable, they had a charitable philosophy to them, which meant that many filters were given away or water points were constructed without regard to governance, such as a village water committee or the community's contribution to the operations and maintenance of that water facility. So HANWASH is looking to change that. And fundamentally, what we're looking to do is move past the idea of charitable relief and move to something that's more locally owned and sustainable. And that's really, it puts the Rotary Clubs of Haiti at the very center of that entire model. We have a bold vision for Haiti. We believe that we can deliver access to safe and sustainable drinking water and sanitation for literally the entire country of Haiti. This is a mammoth project. It's actually a program that many people believe is so audacious that could it ever really come to fruition. We believe that it is possible, and we think that you know, if we don't succeed, we will at least have tried. But we believe that it will probably take a generation, 30, 35 years for us to make significant headway towards this goal. How are we going to do it? Well, first of all, we want to leverage the idea of partnerships, bringing more capable organizations than ourselves or even Rotary to the table to be able to work in a coordinated fashion, aligning themselves around the government's priorities, around the community's priorities, and being able to leverage each other's strengths. So we're fundamentally an umbrella organization, and we bring all sorts of partners to the table. Communities, we bring Rotary clubs, districts, government partners, private sector partners, NGOs, and funders. So we are, HANWASH is fundamentally a program. It's not a series of projects. We are currently focused in 7 counties around the country, so 7 out of 144 counties shown on the map. And over the last 3 years, we've mobilized about $1.6 million US in project investments through contributions directly from Rotarians, and then also from matching contributions through the Rotary Foundation. We are now growing at such a rate that I believe that it is possible for us to double that number this year. So that at the end of 2022, we'll be looking back and I'll be saying we've mobilized $3.2 million in investments. The 7 counties that you see on the map here represent about 770,000 people, or roughly 11% of the population of Haiti. And so with these $1.6 million in project investments, we're still only touching 17,000 people. So as you can see that this is a mammoth undertaking for the country. We have a number of different partners who are involved. Fundamentally, HANWASH is a partnership between the government of Haiti, a technical solutions provider in the form of Haiti Outreach, and Rotary, which represents the community as advocates. You'll see that there's really no big financial donor partner there. Rotary, it's bringing that grassroots community-based demand to the table. If there's a problem in the lack of access to water and sanitation, Haiti Outreach is an organization which has been working in Haiti for 30 years and has a proven track record in delivering sustainable water and sanitation. And then we're doing this work with the government's blessing, which is so important. We have a number of different implementing partners who represent the various elements of the WASH sector. They help us deliver the technology, the capacity building, the engineering expertise, the project design. And then we bring to the table, and this is a really creative part of the Rotary model, is that we bring Rotary international districts from around the world as partners, and we line them up with Rotary Clubs in Haiti to basically adopt a county. So for example, the Rotary Club of Likai, which is in the southwest of Haiti, is partnered with District 6960 in Florida. And their mandate is basically to deliver water and sanitation to the entire commune's population, roughly 70,000 people. And so that program of work may take, it may take 5 to 10 years, but they're committed to working in partnership. And they do that, they bring Rotarians to the table to provide service, to volunteer, to use their voice to advocate for the needs of the community, and then also to leverage resources as well. So our core values are really important to us. This is where we do things differently from how other organizations have worked in Haiti in the past. And the most important one is at the top. It's this idea that we are community-based, that we work to empower communities to participate in the governance of water and sanitation. So what that means is, practically speaking, is that we don't go in and we don't force a project on the community. We wait for the community to signal their needs and priorities to us. And we go in there, we work with them to construct a vision for how they want their community to look. 5 years from now, 10 years from now, sanitation, water, education, health, what are their priorities? And then we offer support to help them get there on the water and sanitation component. So we place them in a position where they can define what the future looks like for their citizens. We're also collaborative. We provide opportunities for every partner organization or Rotarian that wants to get involved in HANWASH can get involved in HANWASH in a meaningful way. And we do have 80 Rotarian volunteers from 10 countries working with us on HANWASH at the moment, which is incredible. And they join on a Zoom meeting every Wednesday at 10 o'clock. You are all welcome to join us as well to be able to discuss the progress of the HANWASH program, to learn and to share and get involved. We are systematic. We think about the way we do things, we plan, and we learn from our mistakes. When we think about the impact of our work, sustainability is a major metric that's driving all of our efforts. And it really starts with generating that community-based demand for water and sanitation, having the community pay for service. Small amounts, $1 a month per household. It's not much, but when you're looking at a community of 30 to 50 households, each contributing $1 a month, that's enough to sustain the operation and maintenance of a small water point that's delivering water to all those families, something they didn't have before. And finally, the one that's one of my favorites is really that we're committed. When I think about Rotary, when I first became a Peace Fellow, I was really inspired by Rotary because of the work that Rotary had done on polio eradication, and how it's just been at it for decades. And it's so humbling to see the dedication that Rotary has brought to that cause. And I like to characterize what we're doing in HANWASH as we're doing the same thing. We're going to keep at this. If it takes decades for us to be able to solve this challenge in Haiti in partnership with Haitians, then we will keep working at it. That is for me one of the things that inspires me most about being part of the HANWASH program. So advocacy is the recipe that makes HANWASH work. This is the secret sauce. Everything starts with the community, and the community is represented by a Rotary Club. So there are 22 Rotary Clubs in Haiti. There are 16 Rotaract clubs, and we are engaging both Rotary and Rotaract. So roughly a population of about 750 members of the Rotarian family throughout the country. And then the 7 counties where we are working, each commune or each county has been matched with a local Rotary Club. And then in that Rotary Club, a leader from that club is named as a HANWASH ambassador. Then they recruit 4 to 6 members of their club to join a HANWASH committee. And then a member of that HANWASH committee will then become the primary sponsor on a grant, and then work with HANWASH and an international club or an international district to develop a grant that can provide funding for a water and sanitation project in the commune where they are working. And that HANWASH ambassador is the focal point of conversations with all of the key stakeholders that are required to generate an action plan around water and sanitation. It's the government, so it's the local mayors, it's the elected council people, it's the local citizens, women and youth especially, it's the private sector, and it's other, international NGOs or even small community-based organizations, volunteer organizations that may not have the clout of Rotary, but are eager to contribute to the development and the well-being of their communities. And funding partners, we bring those to the table. And so we enable them all to participate in a dialogue, a space. We create a space where they can contribute to the action plan for that community. We use data to drive a conversation so that folks know where water and sanitation access is lacking or is inadequate in certain parts of the country. And that data is being collected at the local level using mobile phones. It's uploaded into a platform online, and then that data is immediately visible on an open source public platform called mWater. And then what we do is when we go and we have conversations with the local government and the citizens, and everyone's gathered, we can show them the map and we can say, well, these are the folks in your community who are currently living next to a water source. These are the folks who lack any sort of water source. Who are going to be the priority communities that you're going to want to invest in next? And how do we make that decision? And we leave that up to them to decide. We offer some criteria, we offer some technical guidance, we structure the conversation, we facilitate it, but ultimately it's the mayor, the elected council people, and the citizens they represent that are deciding what are the priorities for water and sanitation investment by HANWASH and by Rotary. The local advocacy process is being conducted by the local Rotary Club. As I mentioned, the HANWASH ambassador, the committee. And we, in the beginning, it wasn't a structured process. We didn't have a clear recipe. We just knew that that could work. And as we've developed that program over time, we've now come up with a list of steps about how the advocacy gets conducted, right? There's a lot of process here, right? But behind all of this, it's like WhatsApp phone calls, it's knocks on doors, it's visits, it's letter writing, it's media attention, it's getting the local newspaper or the getting things posted on Facebook, it's drumming up attention or gathering citizens in an open space and just dialoguing with them, sometimes for 2 or 3 hours about some of the issues. But there's a systematic process that we follow, and every club that we're working with in Haiti is following this process. And then our goal is to learn from the process that we're doing now and scale that up. Because we won't be able to cover the whole country if we don't develop a model that can't be replicated and can't be scaled. So in these 7 counties, 770,000 people, we're figuring out the recipe that could go to 11.4 million people. And we have learned so much in the last 3 years that's already starting to pay huge dividends. This is the Club of Likai, one of our strongest partners in Haiti, one of the strongest clubs in Haiti. They're established in 1978. very, very vibrant club. I was in Haiti a couple of weeks ago, and I met with the HANWASH committee. I met with the president and the president-elect. We went for dinner, and we, had drinks, and we had fellowship, and we went to visit the communities. We met the mayor, and it was just such an amazing connection and experience to be able to develop those relationships with them and see their level of commitment and engagement to helping their fellow citizens. And while I was there, the club announced that they wanted to make a generous contribution to the next global grant that's being developed right now in Haiti, in the commune of Cavaillon, which the entire HANWASH team is feverishly working on day in, day out right now. We're looking to get that submitted to the Rotary Foundation by March 31st, and plenty of opportunity for your district to contribute if you are interested. So please talk to the chairs of your international service committees. That is my call to action for you all tonight. So this is an example of a HANWASH well that was delivered following the model that I described to you. On the left-hand side, you see the newly constructed well house. So that's a protective structure that prevents animals from wandering in. It prevents vandalism. It provides a certain cachet and respect within the community. The donors' names and the partners are painted on the well as a sign of acknowledgement and respect. And you can see the Rotary Club logo is there, and the district logo is there. And the folks that are in that picture there include not just members of the community, not just the elected leaders, but also Rotarians and Rotaractors, which, this is really a partnership. And on the right-hand side, that is the celebration when we inaugurated the well and officially, cut the ribbon and it was open. And all of the members of this community, in this particular, the village of Pacwa, it's roughly 35 households. They're all contributing on a monthly basis. They have a volunteer-based water management committee, and they have been trained in budgeting. They've been trained in simple repairs. They've been trained on how to keep their books. They hire a security guard to protect the infrastructure. And so we have a similar model that we incorporate in all of these communities. This is an example of one of our more audacious global grants that we are currently implementing. It's a $331,000 grant to rehabilitate the piped water system serving the small town of Cavaillon. The investments we're making will improve access for about 5,500 people. We're about midway through the execution of this project. We're expecting construction works to start in June. We're right now in the process of running, or about to start, a competitive bidding process in partnership with the Regional Water Authority. And we are inviting local contractors. And one of the premises around which HANWASH operates is that we are trying to ensure that the majority of the funding that comes through HANWASH is channeled to Haitian contractors, Haitian companies. And we encourage Rotary-owned companies to apply and compete for that work in a fair and transparent way. One way in which we encourage Rotarians locally also to get involved in HANWASH. We also have a program to strengthen engineering capacity because there's a huge scarcity of qualified engineers in the country. And if you're curious about the structure of how it all works, so as I mentioned, we have 80 Rotarian volunteers in HANWASH. We've only got 2 employees. There's myself and our recently hired, just 3 weeks ago, Ermita Mingo. She's our new program support coordinator. She's full-time based in Port-au-Prince, and I went down to Haiti to meet her and onboard her and introduce her to our partners. So we support, basically, effectively, the Rotarians who are leading the work. We exist to serve the Rotarians who are making HANWASH possible. So the 80 volunteers are spread across our board of directors, a steering committee, which is composed of 15 Rotarians, one of whom is Ron Denham, and we have 11 subcommittee chairs. And the chairs are all like little departments: finance, marketing, fundraising, operations, monitoring and evaluation. And then so volunteers get pooled onto those different teams to provide support. And then the HANWASH model, as a recognized, legally established nonprofit in the United States, we provide a formal mechanism for engaging with local contractors in Haiti. And we exist to support the Rotary Clubs of Haiti. So we're there, we provide that backbone support. So legal advice, translation, all the marketing the monitoring and evaluation, all of the different elements you'd expect from a well done water and sanitation investment. And it's a big little picture of the different members of our management team. We are up to 17 folks on our management team. Some familiar faces for you there, I'm sure. I was speaking with Director-elect Jeremy Hurst just before this call. He sends his regards to all of you. I think some of you know him really well. So there's an opportunity for some of you to get involved if you're interested to provide service to HANWASH. A couple hours a week or even a couple hours a month, you are welcome to show up to one of our Zoom meetings and join in what I like to call the HANWASH approach. Basically is replicating the polio model, but taking that for water and sanitation with 3 key ingredients: advocacy, fundraising, and service. So that is my presentation for this evening. I'll stop there and hopefully we can engage in some questions. Thank you.
Well, thank you very much, Ryan. Just want to see if there are any questions, obviously for Ryan or for John. Great opportunity to get input into their various programs and studies.
I would like to ask a question if possible.
Oh, sorry.
Brian, great presentation as always. Very encouraging. Can you speak to how you're bringing water to the community, but who pays for the connection for the water? And is the house ready to accept the water? Meaning, do they have facilities in there like a sink or a toilet or a tap or whatever?
Yeah, that's a great question. So like in rural villages, the homes are far flung, widely dispersed, right? So we're not, our first step there is not a piped water system where water is being delivered into each home. If the community establishes that that's their vision and they're willing to pay for that level of service, then we will work to that standard. But our benchmark is to deliver a water system, a water point, a hand pump or a solar operated water point within 500 meters of every household in that community. So roughly a 5 to 8 minute walk, which would cut the walking time for most Haitians down substantially. But that is just our starting point. If the community defines that it wants to step up, we'll be there. We'll be right there with them. We're also working in small towns where there is a piped water system and folks do have pipes either running into their homes and they have a sink with a faucet, or there's a stand post in their yard, right? So they can go out with a bucket and collect water, but they don't have to walk further than their front yard. So that's an option. And then there are also little kiosks that are established around towns. So people can go and, either purchase water from a water vendor, that water is being purchased from the system itself. So what we do is, as we go through the model of developing this in that community, we're looking at what the current price is for water, the status quo. And then what we're doing is basically developing a project model that reduces that price. So in the northeast of Haiti, we're working in the commune of Ferrier. People there are currently paying about 10 cents for a gallon of water. And we're looking to reduce that to about 1 cent per gallon with a piped water system. So that is our latest approved global grant. The global grant was approved 2 weeks ago by the foundation trustees for $500,000. We'll be starting work on that in the coming weeks.
And then also, how happy are the people to actually get clean water, and they're paying for it because they're obviously on a reduced budget, but now they're paying for water, but it seems that they're happy to pay for it.
Yeah, they're happy to pay for it because it's an improved level of service, right? But the trick is, first they've got to believe that an improved level of service is worth paying for. And in Haiti, there's no such thing as 24 hours a day safe drinking water running from your faucet. That doesn't exist anywhere in the country. So we can't go in there and promise folks that that's what they're going to get next year. We've got to step it up. So we're starting with a small but bite-sized piece of the vision, and we are working with them to be able to create that buy-in, something they can believe in, and that they feel it's a level of service they're willing to pay for. And as they see that level of service improve, if they see value in that, they would be willing to pay for it. That fundamentally, if it's demand driven, we're there to respond to it. If they're not interested, then we will work with another commune or another community.
Thank you.
Brian, this is Ravi Joshi from Whitby. It was a good presentation. I have a couple of questions. What is the standard for the quality of water delivered to your customer?
Free of contamination.
How do you measure that?
Well, so I mean, it depends on what the metrics are for that particular area of Haiti. So it depends if there's arsenic contamination or fluoride contamination in the groundwater, right? But generally, most of the communes where we're working, we're not seeing that kind of non-bacterial contamination. So we're primarily focused on treating it with chlorine to prevent E. coli contamination and making sure that there's a residual at the household level.
So is there a regiment of testing the water periodically to make sure that what you have done is delivering a good quality water?
So yes and no, that's the aspiration, but we have to be really careful how much of those responsibilities we take on, because that is the government's responsibility. So we work with the government to establish, like, to figure out what their vision is for providing that level of service to the community. And then we look to work with them to get there. So if we started to create a parallel system where we were doing the government's work in its place, then we're not sure that that would actually contribute to sustainable development of the sector. So Ravi, it's a little bit of a yes, but answer. It's sort of like, it's a bit of a dance, right? We're trying to go in steps and to work with the government in partnership to get to the vision of a level of service that might look like what we have in Toronto or Montreal.
Okay, so what's the source of this water? Is it from the well? Is it from the river?
It's groundwater. Yeah, it's groundwater. We're digging boreholes into the ground 100 meters deep, basically drawing water out of the ground.
Okay, but you don't check for any heavy metals or anything like that?
Well, so the partner that we're working with in Haiti has 30 years of experience. So with that kind of knowledge, they are familiar with the local context and whether or not there's a risk. So you wouldn't test every time because you just come up with the same answer. So at a certain point, you can assess the probability of, heavy metals contamination. And if the risk is low, then you wouldn't test for it because you'd just be wasting resources.
Okay.
Yeah.
So you're drawing from a ground well, as I do here in my rotary water plant that I have been running. Do you have a submersible pump, or you have a pump, high pressure pump?
Mike, so you're throwing these technical questions at me, and
if you don't know it, just make it up.
Yeah. We have a pump on the well in Cavallo, which is I believe that's sitting partially submerged, but it's partly above the ground as well. Yeah.
Okay, thank you. Great job that HANWASH and WASH is doing in Haiti. Ryan, you're a blessing to our organization. I can tell you that I attend the Wednesday steering committee meetings, and the wealth of knowledge of the people that are on the 100-something people that are there are incredible. Ryan, can you talk to that?
Oh my gosh. So I'm so humbled by the number of hours that the commitment and the level of engagement that people have been giving over a period of years, every week, day in, day out. I mean, we have retired folks, retired engineers, retired project managers, lawyers who are involved in HANWASH and devoting, in some cases, 15, 20, 25 hours a week, and smiling and enjoying it and showing up to every meeting and coming back for more. And then we have others who you show up to the meetings and they participate, here and there. Translate this document, or I'll write this newsletter, or I'll contribute to a global grant this way. So it really varies, and we welcome everybody.
Dave,
John,
Dave,
do you have any questions from the chat?
yeah, two. First one is Dave Andrews from Oshawa. If a club in District 7070 has, say, $500 or $1,000 to spend on one of the grants, who would we contact and how soon would you need it for HANWASH program?
Yes, so the short answer is we have a global grant. We're looking to close it by March 31st. It's roughly a global grant of about $300,000. So we are raising contributions from clubs, cash contributions from clubs and districts. We're also raising district designated funds. I'll throw my email into the chat. If you want to take it down and write to me, then I can connect you to the folks in our team who are handling the fundraising for that grant.
Okay,
But your money might be better with DDF because Ryan was going to get his $30,000 for his global grant by probably day after tomorrow.
We would love to have DDF too, because the foundation matches that at 80%. So that's a huge bonus for us.
The next question is from Rob in Campbellford. Is the pricing of the water sufficient to pay for long-term maintenance of the system?
Yes. So the short answer is yes, especially on the rural wells. So what we've seen, so we subsidize the capital costs, right? I want to just be really clear and transparent. We are subsidizing the capital cost. So we will raise money from Rotary Clubs. It's about $20,000 US to drill a well, to test the capacity of that well, to then test the water quality, install the pump, and then get it working. It's about $20,000 from start to finish. That includes the whole community engagement process. But from the day that that community well is launched, the community is entirely responsible for funding it at about $1 per household per month. In an average community side of about 30 to 50 households, they will actually accumulate a surplus of about $50 to $100 US per year. And that surplus will accumulate over time, and then they can use that for any outsized repair costs. And what we've seen is that the sustainability rate rises from 50% to 87% with the model that we're using.
Is that $100 per month invested in some kind of scheme that earns high interest?
Sorry, I'm not sure I understood the question.
Okay, so you're getting $100 a month profit from the 30 households that are paying $1 a month. What happens to that money? Does it go into a bank account with
So
interest earning?
it's not HANWASH. We're not earning anything on this, right? So
no, the $100, does it expand and get better from investments?
So I mean, as a former, I used to work in investments, so I would love to see the community be investing their money in interest earning savings accounts or putting it in the stock market and earning 7 to 8%, maybe not the last 3 months, but but basically, so they're accumulating a surplus, they're putting it in the bank account, and then they can draw on that money when they need it. So they're not earning huge amounts of interest on that. I would love to explore a program where we could maybe create a cooperative of village water committees where they could pool all of their savings collectively, reach tens of thousands of dollars across the country, and have that invested in a way that generates interests collectively. That would be really cool to look at.
Okay, folks, I'm going to interrupt for the moment. We have a couple of other things to do to wrap up our evening. So I'm going to call on District Governor Ron Dick to thank our speakers.
It's my pleasure, Pastor Governor Beth. And first of all, I want to say to John, let not your heart be troubled. In Rotary, we're not a lot of lawless people, but all of our rules are set up to make projects happen. So please feel free to join our Rotary Club. And I'm pretty sure you're going to get 55 invitations right after I speak here. John, thank you. Ryan, thank you. We're a strong Rotary district. I mean, we've got Steve Rutledge right here on the call who does some great Rotary projects, water projects in Laos. We've got Barb Jarvis that does some great Rotary filtration projects in the Dominican Republic. So we're near and dear to your hearts that way. thank you for throwing the glove down and giving us some challenges, because you've given some great ideas to the many Rotary clubs that are here on the call today. And I'm sure you're going to get a response from that. So thank you for sharing with us today. We're going to make a donation to the Rotary Foundation in the honor of you each having spoken to us today. So thank you, John. Thank you, Ryan. And we look forward to working together in the future.
Wow, awesome. Thank you. Thank you so much.
Just before we wrap up tonight, I don't believe we have our March Tuesday Talk coordinator online. So I'll take the liberty of introducing our March Tuesday Talk, which will be held on Tuesday, March the 8th. And that happens to coincide with International Women's Day. So we have two very esteemed speakers, past District Governor Linda Ryder and our District Governor nominee designate, Virginia O'Reilly, who are going to both speak about breaking bias. So thank you everybody for joining us tonight. We look forward to seeing you in March for our March Tuesday Talk. Have a great evening, everybody. Thanks for joining us.
Thanks, everybody.
Thanks very much.
Thank you, Beth.
Thanks for having me here, everybody.